Thank you. One last question.
Yes.
If you were to recommend dental decoding to anybody, what has dental decoding add to your practice, done for you personally, and why should people take it?
Oh my. Um, hmm. For me personally, I had perfect teeth and gums 5 years ago before I moved into this house and life happened. And dental decoding has helped me discover a lot about myself and my feelings and the issues. Relationships are what dental decoding is all about. Relationships with ourselves, our little teeth, with our parents, with our job, with our family, with our home. It's all about relationships. And dental decoding, a little bit different than regular whole body biological decoding, happens fairly immediately. I think I understood Dr. Brotos say, happens fairly immediately after the conflict or the conflict resolution. Sometimes with the regular decoding, it can happen 50 years ago and then gets triggered now, and you have to go back and try to figure out when was it programmed and when was it triggered and how all of that happens. But with dental decoding, it's usually pretty direct, pretty quick feedback. So how I use it with my clients is in my little questionnaire that I send them before I decode. That's one of my questions. Do you have any recent dental issues? Do you have any dental issues? And you can look at it, and even when they come to see you, if they say, well, I don't know what happened, if they've really got a wall built up around the issue, then you can look at their teeth, and the teeth do not lie.
Yeah,
and
yeah.
Teeth are not protective, they show it. So it really helps with the decoding process and understanding a client, especially if they've got a lot of walls built up or they're not comfortable in talking about things.
So if what you're saying is I broke up with my boyfriend last night, and 20, I believe, is the one that deals with, 21 is the one that deals with relationships. And I have all four things going on: the emotion, I have the carbs, I have bacteria in my mouth, and I have the echo of the conflict in my family and my clan. So pretty much maybe that night I'll be cracking that tooth or developing a cavity. Is that what you're saying?
Perhaps. Like decoding, you don't say, well, looks like you're going to crack a tooth. Somebody comes in with a cracked tooth and then so you don't. You could create something.
So that's regular medicine. It looks like you're going to get cancer by eating an apple. So.
You don't want to do that. So they come to you with an issue, with a dental problem, with a physiological problem, and you work back from there. But it does, it happens fairly soon. So it's still fresh in their mind. It looks, I cracked this tooth last night. You look it up and go, did you recently break up with your boyfriend? And go, how did you know? So that's how that works.
Okay. That makes a lot of sense. And why should people take the practice? I'm not a practitioner, and I'm taking it. As you know, I was very little and I lost all of my teeth, all my baby teeth, pretty much all at once. It was very interesting and very expensive for my parents. But my adult teeth have been very good. Good smile, healthy, the typical cavity here and there, but nothing like root canals, knock on wood, or anything like that. I think I'm doing pretty well as far as my teeth health until recently, where gums just started changing, my bite started changing, my jaw started moving, and there has been so many changes in my life, as you know, people passing, people moving on, the pandemic, all of those stresses, and everything about my mouth health has changed. I know now why, but I think that's what would help people know. But why would you recommend somebody like me that doesn't practice open with people, and why would they take dental decoding?
I think it's a tremendous help to take dental decoding to understand yourself and
Understand
to
yourself.
notice when little things start. I mean, then, well, sometimes it does happen overnight, you know, like a chipped tooth or um, uh, something acute that happens in your mouth. But if you notice, yeah, my gums are receding, well, just this one, it helps to understand yourself. If you don't know it by heart, look it up. It's there for you to look up, and by checking it out, you can understand how you are reacting to some certain situation. Gee, I didn't know I felt that way about it, but I must. Part of me that I'm not conscious about, my subconscious mind, really is upset about this.
Mm-hmm.
Long enough to cause the gum to recede or for the cavity to form. So it really helps us understand ourselves and those around us, you know, our children, our parents, etc. So if anyone around us has a dental issue, you don't have to have them as patients or clients, but it sure helps you understand what their subconscious mind is going through, whether or not they say things consciously. People are very good about hiding things and not wanting to worry people or upset them. And the teeth don't lie. So if you know you have a parent or a child that says, "Oh, I got to go to the dentist," oh, really? Which tooth? You know, you can find out what's going on without appearing to be interfering and understanding. And by understanding that, you can reverse engineer. Well, what's going on in at work? What's going on here? And help them in the process, not necessarily decode them, but that's kind of what you're doing, is understanding their situation, understanding their emotions. And if you have any practices for emotional healing, whether it's the emotion code or tapping, NFP or any of those things, if you have any of those skills, then understanding the issue, whether they've told you or not, you can go address the emotion, help them relieve that before it gets to a very severe situation. So you don't have to practice it professionally. It helps you and your family and your children and your pets, anybody around
Yes.
you, to understand them. So maybe you're not quite so quick. We are not quite so quick to get upset with them for saying or doing or feeling something. When we understand the dental issue, we can go, oh, I know what's going on. So we look at it from a different point of view, from a different perception, so that it takes care of our reactions as well.
Mm-hmm.
When you
Mm-hmm.
understand